So what are some examples on bispecific antibodies in lung cancer? I think we talked about them. So we have our amivantamab, right? We have our tarlatamab. Amivantamab is approved in EGFR positive non-small cell lung cancer in the first line and the second line. We have tarlatamab, which is approved in small cell lung cancer. That's an example on BiTE, bispecific T-cell engager. And ivonescimab, it's not approved yet. It's approved in China in some indications, but here in the US, not approved yet. But it's a very promising drug that binds to PD-1 and VEGF, the baby blood vessels protein, at the same time. So what are future perspectives in bispecifics? How can we make them better? Let's start with this cycle from A and then go to E. So number one, patient selection. So biomarker discovery. How does these drugs work? What are the important proteins? How can we select patients that might benefit more from these drugs? The number two, I can't see it here from my screen, but I think we're talking about the dose optimization and trying to manage the efficacy and the toxicity, or optimize the efficacy and manage the toxicity at the same time. C is trying to enhance the clinical efficacy by combining it with other chemotherapies, immunotherapies, other targeted therapies, something that makes sense to the cancer cell. And then to try to overcome the resistance, right? Like we talked about, there's always resistance, to try to predict it and then overcome it. And lastly, try to overcome the immune escape. So all of these drugs that we talked about activate the immune system, but sometimes the immune cells will get exhausted. They will get burnt out and tired. So we need to learn how to overcome this. So that's my last slide. I think I'm right on time. So the take-home messages: ADCs and bispecific antibodies have revolutionized the way we treat cancer, not only lung cancer, I think all cancers. Number two, you guys can think of ADCs as a chemo on a stick or the chemo mailman. You can think of bispecific antibodies as the fork with two prongs, one for a steak, one for potato, or one for hummus and one for falafel. And then both mechanisms of actions are designed to be very specific to the tumor-associated antigen in order to potentiate the effect on the cancer cell and be as specific as possible. And then scientists are not stopping here, of course. Many novel forms of ADCs are coming. Many novel forms of bispecific antibodies are coming to the clinic. So stay tuned. And with that, I would say thank you guys so much. And I'll hang around for the panel, of course, and the Q&A session.
Thanks, Dr. Rous. Really appreciate it. We wanted guys to start off with a lot of hope here, right? So clearly you've learned that there's a lot of new classes of drugs being developed for patients with non-small cell lung cancer, even small cell lung cancer. We're seeing some of these drugs in that space too. So a lot of hope, a lot of excitement. We'll tap you back in, Dr. Rous, very shortly for our panel.